So we have approximately 1,000 children and families that go through each year. We currently, our numbers are close to 500 between the Plymouth location and this location of children and families that we're serving. And similar to most mental health centers, we are currently running a wait list for kids because of the pandemic. There's an increased need. Kids are experiencing more anxiety and depression and adjustment issues, as well as family stressors because of the impact the pandemic has had. So we're currently trying to accommodate as many of those patients as we can.
Yeah, to add to that, usually in May, we start to see a decrease in our numbers. And this May, it's anything but. We're seeing there's no slowdown at all. We're just getting more and more calls with parents, guardians wanting to get their kids in.
There's also an increase with children being hospitalized, which is atypical. Usually the numbers for children sort of boarding in EDs, emergency departments at local hospitals, is relatively low. And we've also seen an increase with kids that are meeting the criteria for psychiatric hospitalization, and we prioritize those patients for intake and services.
Children who are living through some really difficult times in their lives. A lot of kids are dealing with addiction issues with their parents, where they may have lost a parent or they have no contact with a parent due to addiction. They're living with guardians, they're living with grandparents a lot of the time. A lot of school resistance because of COVID, with severe anxiety, kids just not going to school at all, not keeping up with school, becoming school resistant, OCD around germs and getting sick, or fears of, if I catch this and give this to someone in my family, my parents could die. So a lot of that. At Lakes Region Mental Health Center, we are here to support kids in all sorts of different ways. It can be a simple consultation call. Maybe a parent or a guardian has a question or a concern and they just want to talk to a professional to feel it out. And that goes all the way to a referral for an intake assessment, to come in and talk about what's going on and assign therapy and any additional services that could be warranted. Psychiatric care, medication management, individual therapy, family therapy, it could be community support.